Hello and welcome to ADHD Mums. In this podcast, we tackle the tough, often unspoken realities of motherhood, neurodiversity, and mental health. Hello and welcome to the next episode in the Hormone series, which has been very highly anticipated, particularly by me, if no one else. And this episode is called While Hormones Hijack the Mind, ADHD, Perimenopause, and Emotional Burnout. And in my searching across Google and Instagram and everywhere that I go, I came across Dr. Sunita Chalva from Menopause and Women's Health. Welcome to you, Dr. Chalva.
Thank you so much, Jane. Thanks for having me on the podcast. I'm really honoured.
Now, Sunita, I would love you to give everybody a really brief introduction about who you are and what you do and what you're about.
Okay, so I am a women's health and menopause GP. Myself and my colleague started Menopause and Women's Health in Perth, WA, about 2 years ago. We're very passionate about all things to do with hormones, and naturally that's why I'm here. There's a very big transection of hormone, neurodiversity, ADHD. Every day of the week I speak to women who struggle with all of the above, and it's become a real sort of interest and passion of mine because I believe we really don't know much about the female brain. I have had my own experience of early menopause. There's all sorts of threads of neurodiversity in my family, diagnosed and undiagnosed, and I feel like I'm on a journey myself learning about it with my patients.
Beautiful. Well, we have come to the right place. Now, we have a really active Facebook group, and one of the questions that comes up really often is around, my kids are a little bit older now, let's say. I'm actually struggling more than what I was when they were younger, not because necessarily actually the parenting is harder or I'm feeling like it's more difficult, because I'm actually have got less coping and I feel like I'm in some kind of emotional burnout. What do you think this looks like in ADHD mums?
Yeah, this is very interesting, Jane. As I was mentioning, ADHD and hormone have really only ever been studied in men and boys. And so we have a very different picture. It's a very different reality for women. Women don't get diagnosed often until perimenopause or when one of their children does or at the same time. I just want to go back a few steps though, if that's okay. What is perimenopause? It's actually this time around menopause and it lasts about 10 years, but there's this huge fluctuation of hormones. We're talking about estrogen and progesterone. And with it comes a variety of symptoms and sometimes change in menstrual cycle, but most importantly, the mood and the brain issues are usually due to this neurotransmitter flux, the dopamine and serotonin, with the hormone fluctuation. So when you're talking about burnout, as you said, these women are late 30s, 40s, early 50s, managing children, managing jobs, managing maybe aging parents. And so what does burnout look like in tandem with all these things that they're juggling? A lot of women would notice brain fog, cognitive clouding. They definitely say, I've got more difficulty with my attention, with my memory, can't switch between tasks. They're using a lot more compensatory strategies. So they're trying to mask more. I'm trying to give the impression that I am perfect. I'm coping fine. I've got all these balls and I'm juggling them beautifully. But often they end up feeling quite mentally depleted. Their executive function worsens even in their normal tasks. So driving is a very common one that women will suddenly become very, very short-tempered or forget where they're going. The other thing that presents as burnout or contributes to burnout is a very heightened sensitivity. So we know that with neurodiversity, with ADHD, definitely there is that concept of rejection, sensitivity, dysphoria, but it becomes more prominent. So there's noise, there's mess. Hubby might be saying something to criticize you. Your children are needing you more, and that emotional reactivity increases. There's irritability, there's emotional lability. So again, with these fluctuating hormones, there's fluctuating moods. It's tied to the lower emotional thresholds with ADHD. There's physical restlessness, sleep disturbance, but severe PMS. We're not talking about a bit of bloating and a bit of teariness. It's significant mood decline often with suicidality, very deep depression in the second half of a woman's cycle. So in perimenopause, that becomes a lot more prominent. And we actually estimate maybe around 50 to 70% of women with ADHD have PMDD. And that further adds to this burden of chaos in perimenopause. And this is compared to in the normal population, 5 to 8% would maybe have PMDD. So 50 to 70% is huge. The two go together. So all of this contributes to this massive overwhelm. And so women come in saying to me, I've just reached my emotional tipping point. I've gone from 0 to 1,000 in 10 seconds. I feel like I'm going to kill my husband, my children, my workmates. They're more prone to crying and anger outbursts, and they're very frequent and intense. And they start feeling guilty and they spiral from there. And that really does lead to a loss of identity, self-esteem, impacts mood, and then we get this burnout. You can see how there's so many different contributing factors. Women will say, I used to be an absolute master at multitasking, and now I'm just dropping balls all the time. Or conversely, with the burnout, they say, I have no initiative. I have no brain energy. I can't complete that particular work task. I can't organize the playroom. I'm so slow. There's very much a big mismatch between the internal expectations of the woman and their capacity. And all of this is cumulative. It just builds up. So mental, emotional, physical exhaustion. There's prolonged stress, cognitive overload, flux of the hormone, and this masking. So it's really important to note that the highest rate of mental ill health and suicide actually occurs in this time frame of perimenopause, 45 to 55, which is scary.
I feel like this episode is going to have a massive impact, which is fantastic because this is what we want, because you're talking about things that either I feel or I've spoken about with close friends or at a mum's dinner. We all talk about that because those are really real for us. And we had an electrician come and do some work on the house. And for some reason, I can't remember how, the Sunshine Coast is so small, we realized that I was friends with his wife. And I had friends with her, let's say 8 years ago. And at that time, I had 3 kids under 4, I think. I had a really great time there surfing at a surfing program with his wife. Apparently, she would come home and say, I've met this girl, Jane, at surfing, and she is so much fun. And I remember his wife, we did have a lot of fun. However, after the surfing program ended, I didn't see her again. We never really exchanged numbers, lots of kids, things happening, right? And when he was telling me about how awesome I was and how great I was and what his wife used to say about me, I thought to myself, holy shit, he has been working on our house for 1 week and I'm 100% sure he has seen no joy, no happiness, and he must be thinking, this is not the same person. And he's lovely. And when I walked away, I thought, how have I become so dull and boring and mentally unwell in the past 8 years when I rightfully should have been like that then? And I think that's what a lot of the stories are that we talk about at mums' dinners or on the podcast. Is that what you hear as well?
Absolutely. I think we lose ourselves. We lose ourselves in the mothering, in the trying to do it all. And I don't know if it's a feature of our generation of women and perhaps our mother's generation of women that we have to do it all and we have to do it all perfectly. Our standards are so high and there's such a mismatch between the two. And then you throw in things that are out of our control because we're very much women who like to be in control of every single area, and it falls apart. It falls apart at the seams. So really, really difficult. And that's a good point, Jane, that, why in pregnancy, a lot of women, ADHD is not something that just pops up. It's been there the whole time. Why in pregnancy? Why maybe in puberty? Why in breastfeeding? Why wouldn't it look different? It kind of similar but different. The thing that we're starting to realize is that women are dynamic beings and we are very much governed by our hormones, and things change at some very important part of our lives. So puberty, we do have fluctuations of hormones. There is that emotional lability. I've got 2 teenage daughters. I know all about it, but we don't have emotional maturity. There's a lot more impulsivity at that time. There's, of course, a lot of less demand on a teenager than a perimenopausal woman. They're not working. They're not juggling a household. They're not financially responsible. They don't have a job usually, and they're very much focused on themselves. So that hormonal flux is going to be different. Move forward to pregnancy, that can be a time where the hormones are very high. And some women feel amazing. I don't know how you felt, but some women from an ADHD point of view They feel very stable, they feel very energetic, and they feel great, but not all women. And fatigue and burnout can be a massive issue in conjunction with that physical demand of being pregnant. And sleep can be affected, which can worsen things. And then you get to the postpartum breastfeeding stage, your hormones crash. It's a little bit like perimenopause, a little bit like menopause. There's low estrogen, high prolactin. Sleep is often completely affected. Again, the cognitive reserve, the brain function, the brain fog. There's a huge shift in your roles between you and your partner, perhaps your self-worth and identity. And that's where everything can change. But none of it really is as chaotic and as draining as this point of perimenopause. And that's where you contrast against the different milestones in our life. It's something to be very aware of. And if you're not there, looking towards and being prepared for.
You know what I think is interesting? I had a very close friend stay with me the other day. She's a little bit older than me, so I think she might be around 43, 44. And she was saying how mentally unwell she felt, which is a common conversation to me. So basically, most of the women that I'm friends with are in their early 40s, so we generally talk about how mentally unwell we feel. And I asked her if she was in perimenopause, and she said, no, but I thought I was. And I went to the doctor and I did some blood work, and they said that I'm definitely not. And so I've just started taking an antidepressant, but it hasn't worked yet. And I feel like if I could write a story about it, the most common story I hear, it's pretty much that one. I was wondering, what are some of the big myths around those kind of things that you might like to share?
One of them is that perimenopause can be diagnosed on a blood test. No, it can't, because to date, we cannot pick with these hormone fluctuations. Often in perimenopause, your hormones are higher than average. So it looks normal. It's within the normal lab range. It really is more a cluster of symptoms, and it begins first in the brain. We always think perimenopause, menopause is hot flushes, night sweats. No, it begins first with that very small drop in the brain of hormones and neurotransmitters, particularly in the second half of your cycle. So even before your cycle starts to change, women just notice very subtly that from ovulation to their period, mood starts to drop. They become a little less competent. They get more scrambled. They feel like the ADHD get worse. They're tired, and they get that real restlessness and irritability. And if it's severe, as I just mentioned, it could be heading towards like PMDD. Now that becomes more and more chaotic, given that perimenopause lasts for about 10 years. Or up to 10 years. What can happen is then you're starting to notice that those symptoms that are affecting your brain occur in the rest of your cycle, that mood is continually down. And so you cannot diagnose it on a blood test. You really do need to speak to somebody, do a symptom scorer on our website at perimenopause.com.au. We do actually have our own menopause symptom score. There's a lot of other places. The Australasian Menopause Society has one. Just monitoring, charting your symptoms. There's a lot of great apps out there as well that you can use. And just taking note of the little changes that are starting to happen, which you never noticed before. Because as we said, when you're juggling hormones against all the other stuff that's happening in your life, as women, typically we tend to put it down to, oh, it's because that child was sick, or I had this on at work. That's why I was feeling like that. That when you actually tease it apart and record it, you'll notice that maybe there is a pattern to it. There is something to do with your cycle and your hormones. There's a lot of myths around this area, this stage of life, though, Jane. I mean, one of them is that you can't take HRT in perimenopause, but absolutely you can. It just has to be done in a very careful way. Now, antidepressants have a place for clinical depression and clinical anxiety. Often at this stage, these women have never had mental health issues. And if you're going to treat a hormonal problem, treat it with hormones, not an antidepressant. Some women who have depression clinically and anxiety clinically absolutely need to take maybe antidepressants or anti-anxiety medications, but it's not necessarily going to treat this very specific hormonal fluctuation, hormonal anxiety, hormonal depression, which is very different. It's very sudden, it fluctuates, it comes, it goes. and can be quite distressing. And often, as you said, it comes about with women who have never had mental health issues in their past life. So it doesn't matter what stage of life they come from. Even the most high-level CEOs, I've just seen, being flawed at this stage because suddenly their brain doesn't work, they're not coping, their mood falls, and women fall out of the workforce, women fall out of relationships. So it's very impactful at this time.
Big burning question for you. You mentioned before that clinical depression would be different to a hormonal depression. How would that look differently?
So clinical depression typically is more of a pervasive, melancholy, flat, not wanting to participate, not interested in anything, loss of libido. That tends to last for 2 weeks at least and will go on and on and on. It's pretty pervasive, whereas menopausal or perimenopausal depression will come, will go, manifest more as irritability. It's not so much sadness. It might be teariness, but it's not that very flat and bad sort of symptom. It's the nature is more fluctuant by far. And it's very sudden onset. It can just come on at this time. It doesn't sort of creep in.
I hear from so many women who are neurodivergent, particularly around when they hit 13, 14, 15. A lot of us hit an extremely depressed or anxious or burnt out school cart is what we kind of call it now. This huge, big crisis or mental health breakdown a lot of us have experienced at that time. And clinical psychologists talk about this now with it being really highly correlated to ADHD and autism and it not being just happened to be, it's actually really research shows that does happen. And I would consider myself a powerhouse in many ways. The amount of shit that I can tolerate, I don't think many people can tolerate. Like I really do feel that is the way I am. That's not necessarily a good thing, but I definitely can keep going no matter what. But last year I had 2 periods of time where I hands down felt like any moment, any day, I could die by suicide. I felt that, it was so bad. I've never felt like that since I was 14 or 15. And I can say nothing in my life at that time was in any way, shape or form going to impact. Like I actually thought it was quite a quiet year for me. And I ended up trying some medication with psychiatrists and I ended up going back on antidepressants for the first time since I was 15. And the psychiatrist said to me, well, Jane, with children that are neurodiverse, like yours, best thing to do is to just take antidepressants because that's just what I give everybody. And I really feel like there's some gaps in psychiatry care that I'm sure you would agree with. And I was wondering, what are some of those red flags that we should look for? Because at that time, me knowing what I know, running this massive podcast, I went along and took them because I didn't know what else to do. There was no one else to ask. I asked my GP, he goes, I don't know. If it's mental health, just do what the psychiatrist said. I went around in a circle. I said to my husband, this doesn't feel right, but yet me being me still didn't do anything. I just took them and went, oh, well, I don't know. I'm just depressed.
Exactly. I mean, as I said to you, all psychiatry until recently has been based on men. So therefore, antidepressants, stimulant medication, diagnosis, everything. Once I've understood that all this time I've practiced medicine has been through that lens, it's mind-blowing to suddenly go, you've got these hormones, estrogen, progesterone, testosterone. They all affect every single cell of the body, but most importantly, every single part of the brain. And therefore, they drive the dopamine, the serotonin, etc. in your brain, which also impacts neurodiversity, mood issues, and the two are very intertwined. Antidepressants, in some cases, are wonderful Band-Aids, but we know that they don't treat everything, and not every woman feels right on them. And a lot of women around this time say, I'm pretty sure I'm not depressed. I don't need an antidepressant. I know I need something else. Another really important point is that women know their bodies. By the time you get to our age, women know what's going on and know their bodies. It's very similar to puberty. We touched on that before. This crazy hormonal flux is very similar to puberty. So the estrogen, progesterone, testosterone are going up and down and up and down and up and down. that is what we really need to target in terms of helping to smooth that out a little bit and help to support that fluctuation. Sometimes it means antidepressants. Most likely it's going to mean hormonal support. So the problem is that psychiatrists, all of us who are in practice at the moment, never learnt about perimenopause and menopause. We never learnt about hormone, particularly from the point of view of psychiatry. But we are starting to see psychiatrists being awake to the fact that hormones have a huge impact on the brain. I don't know if you've come across at Monash University in Melbourne, there's a wonderful professor called Professor Jayashri Kulkarni. She started the Her Centre, which is a centre for women's mental health. And that does all the research, or a lot of the research in the world is done there around hormones, neurodiversity, mental health. So even women who've had anxiety, depression, bipolar are now being looked at, researched through a hormonal lens and treated in a more specific way. Psychiatrists are starting to understand that they have to learn about hormones and they have to prescribe them as well, because we know that there's a lot of limitations with psychotropic medication. Some of the things that I've heard from patients when they go and see a psychiatrist, I guess a lot of us in medicine are very siloed. The psychiatrist will look at the brain. The surgeon will look at the leg. We don't look at the whole picture together. And so therefore the psychiatrists will just prescribe an antidepressant or a stimulant ADHD medication and feel like that's enough to manage the whole picture, but it's not. Often you do need to look at the hormonal picture as well. Equally, someone might see a gynecologist or an endocrinologist and be chucked on the pill. And the pill is very different to taking hormone replacement therapy because it's synthetic ethinyl estradiol and synthetic progesterone. And that impacts your brain very differently to body identical hormones. And so sometimes people are just chucked on the pill and apparently that should sort things out. Sometimes, but not always. Sometimes people are put on the wrong types of hormones. And in the work that I do, prescribing the right kind of hormone for the right woman is really, really important. And some women find, as we said, ADHD, there's a very big crossover with PMDD, premenstrual dysphoric disorder, that they're very sensitive to medications. Women are very, very sensitive to the pill. They're very sensitive, more specifically, to the progesterone part of the pill. They're very sensitive to body identical progesterone. And that can actually make moods worse. And that can be a real problem as well. So I think we're starting to see psychiatrists and a lot of specialists are going to have to be awake to the fact that hormones impact everything and they need to be able to prescribe it. They need to be able to look at mental health from a very different point of view.
Okay, so let's take my close friend, for example, who's had her blood work done and they've checked that and she's not perimenopausal. So she's just going to limp along probably for another few years. If you've kind of been somewhere, they've told you it's not that, but you're listening and you're thinking, well, I think it is. What do you do then?
You have to advocate for yourself. As I said, you have to believe the best about your body and you need to find a GP or an allied health professional, or if you are seeing any specialists who actually believe what you're going through. So ideally a GP, if you believe that there is a hormonal task at hand, I mean, there's certainly a increasing variety of GPs like myself who specialize in hormonal medicine. And I think speaking to them, there's a lot of resources as well online that you can look at, that you can bring into your GP and say, I'm pretty sure this is what's happening. I don't need a blood test to prove it. I have all these symptoms. I've monitored them. I've chatted my cycles. I see what happens. And I believe that I do need some hormonal support. So it's really advocating for yourself, maybe finding your near kin and mums, sharing stories and encouraging each other. Even though we've each got a very different course, don't compare yourself to any of your friends, but we can support each other in getting the right help and sharing knowledge.
So at this point, maybe, I'm sure you're not aware because you're a GP, but in our Facebook group, we have what is called the recommended provider tool. And in the past, I used to advocate very similar. It feels like perimenopause, menopause, and ADHD is similar around. If you've been told you don't have ADHD by somebody and you really think that you do, and it's in your family history and you feel it in your bones and you check all the things, go and get a second opinion. And then I ended up making a provider list of basically providers that ADHD mum said actually asked enough questions to get to the bottom of it. And so I'm thinking now we might expand that for menopause and perimenopause. And I might start putting some female GPs and those specialists on there, because otherwise you may get a second opinion, but you may find someone else that also maybe doesn't understand hormones.
Absolutely. I think get a second opinion, get a third opinion, get whoever fits and resonates with you. I mean, people, when they come and see me, have seen a multitude of specialists, and they're pretty broken by the time they come. And I'd say the magic or the power of our model of care is that we sit down with someone for an hour and hear their whole story, and the whole health story and the whole mental health story. But the power is really not in anything that I prescribe necessarily, but it's in listening to them and validating what they are saying about their experience, because everybody is different. And when we're talking about ADHD, PMDD, perimenopause, I mean, you've had a recent podcast which has really tipped my interest, and I've deep dived into looking at the impact of other things like methylation issues, histamine, MCAS, all these sorts of things are layered in there. At the very base of it often is trauma. And so sitting down with a woman who's got layers and layers and layers of issues, you really need someone to be able to tease it all apart and step through it with you. It can take a long time to feel like you're a whole person again. Often by the time women present, they've been dealing with a lot of these issues for decades. And women with PMDD, women with ADHD, as you said, it starts at puberty and it just fluxes the whole way through. You feel like you've lost chunks of your life through it. And so you need somebody to tease it all apart and try and assist you in getting it all back together. Now, that is not only just a GP. I really believe in a very holistic care approach, so a multidisciplinary approach. So that would be, a very good psychologist and an OT, a social worker, maybe a psychiatrist, maybe an ADHD coach. But you need the people that resonate with you, to understand you and validate you to get you back on your feet. And I would stress the importance of seeking people out who do that.
One thing that I feel like a lot of people talk about with an ADHD assessment is that, because I always say seek a second opinion, seek a third opinion. It doesn't matter. It's still, if you're late diagnosed and you try medication for the first time, it makes it worth it, even if you've gone 3 places already. But it's that kind of like doctor shopping. I don't want to say it is, but you kind of have to advocate for yourself, right? Because I always say to people about ADHD medication, if you don't have it and you try medication, you'll know. You'll know if you have it. You'll know if you don't. Is there any risk to going around, let's say, to a third women's health GP and saying, I keep getting turned away. I'm sure I have this. What if they give you a trial of hormones? Is there any risk that we should be aware of? Does it matter?
Absolutely not. When we're talking about hormone replacement therapy, Jane, we're talking about replacing hormones that already have existed in your body in bucket loads. When you were pregnant 3 times, you would have had huge amounts of hormones. So these are as close to natural as we have. I mean, they are biologically, pharmacologically similar to your own body's estrogen, progesterone, testosterone. And it is always worth a trial. Not every woman does well with it. The same as ADHD medications. It's very individualized. But when you do start it, and I always believe in some starting low, going slow, monitoring your symptoms, communicating with your doctor, if you feel a benefit, absolutely, that's a positive trial. And there's no harm in continuing it. We know that these hormones, there was a big study 20 years ago that everyone has this hangover about the fact that it causes breast cancer. Now that's been completely discounted. We have better hormones anyway now available to us, but taking them long term is seen to be low risk, and definitely in most cases the benefits are going to outweigh the risks. And it's not just for our brains. We have to remember that replacing these hormones will impact our bones, our hearts, our metabolism. There's so many far-reaching effects. There's so many far-reaching effects beyond menopause for healthy aging, which is a completely different discussion in itself. Most importantly, I think it's worth finding a clinician who's actually going to give you that time to say, sure, there's no harm, it's low risk, let's give it a trial, let's see how you feel, come back, and then we'll work it out from there. There's never a quick fix, Jane. particularly in this space, is if you're a fan of ADHD, you're going to have to try. I always say you have to kiss a few frogs to find the one that you really need to be on. So you may need to try a few different medications. And sometimes I've got women who are trying hormone medication at the same time as ADHD medication. And that is very difficult to try and find out which two fit together. Often if the hormones particularly are not working optimally, then the ADHD medication is not going to work optimally and vice versa. The two work very much together. So you really need a team of people to work together to get it right for you.
Let's say if there's people that are trying the ADHD medication at the moment or they're late diagnosed, but they're also in that perimenopausal window and they're thinking, well, is it brain fog or is it ADHD? What one is it? Is there any way to distinguish the difference?
ADHD tends to be even if it's late diagnosed, it's a lifelong sort of cluster of disorganization, inattention, maybe impulsivity, maybe chronic inertia, time management, working memory can be variable. But that hormone-triggered decline is a very sudden, we're talking sudden couple of months maybe, sudden decline in memory, clarity, focus. That brain fog can come and go. It's similar, but it's quite different to what they may have experienced all the time. And if it's very much in perimenopause, women notice that it happened in that second half of the cycle. And then it gets better in the first half of the cycle. And the two can obviously coexist. And it's very hard sometimes to differentiate which is what. And therefore, what we would do is add in that trial of hormones. And that you might find that things improve. So response to the medication might be a clue to the fact that it's more hormonal than ADHD. Sometimes we won't know which is what, but everything improves. Well, that's great.
Oh, I love this. Okay, so as we move to finish up, because I think there'll be people that will be like pressing pause and then just Googling women's health doctors at this point. As we move into that, to give the listeners a little bit of hope that, okay, if this is something that they think might be them, and let's say they're going onto Google and they're thinking, right, I'm going to book in with somebody or I'm going to try again. What are some changes or some things that we can hope that if we are in perimenopause and we did try the right hormone, what could we expect to shift kind of on average or as an example? Because I feel like I don't often hear the stories. I hear the stories of how awful I felt, and then I never really hear specifically what improves for people.
Yeah, I think that overall function improves for people. I think that the greatest measure is when women come back to me and they say, I feel like myself again. Because as we started off talking about, Jane, women lose themselves completely in the whole process. But finding that they're back to their whole selves again, that their mood is more stable, that they enjoy things again. We can talk about medications, we can talk about supplements, but being able to engage in society, being able to exercise, being able to eat well, being able to enjoy your family and your work is extremely important. I do see that every day. I think when you have the added complexity of neurodiversity, it takes longer. There is a couple of steps forward and a couple of steps back. But generally, when we get most of these areas right, I find that women overall would find that they're just so much better in terms of their cognitive function, in terms of their energy, in terms of their sleep, in terms of their libido. All aspects of their life really do get better. And the difficult thing, I guess, is perimenopause as opposed to menopause, which is after your last period. Perimenopause, you will still have fluctuation that goes on underneath. And that can still mean that things are a little variable, but they seem to be a lot more tolerable once you've got the right support, medications, hormones on board. Post-menopause, I guess the hope is that things are more stable because your hormones are more stable. It's really how the woman is able to manage and tolerate what she has in front of her and feeling like you can participate and the clarity of thought and processing and confidence is back. That's a wonderful thing when I see that in my patients.
Wow. Well, that is a great way to end. What I was hoping for, because you dropped earlier that you might be open to doing a separate episode.
Absolutely. I'd love to do that because I think we've just done a good general overview, Jane. So I think going into the specifics would be exciting.
Yeah, look, we need to be aware that people are time poor and they've also got limited attention spans, I think we need to pause the episode and then we should restart next week with the second episode.
Oh.
But I really have to thank you so sincerely for your time. That was one of the best episodes I've heard on hormones, to be honest. And it really made a real impact. I think a lot of people are going to really enjoy the way that you described it, because sometimes when you hear the descriptions, it doesn't fit. But I felt like a lot of the way that you described it really fit, at least myself and some of my friends, and we go around in the circle, and we don't actually ever do anything because we don't know where to go. So I really appreciate that. If anyone would like to work with you, hear more about you, follow you on Instagram, where are you most likely to show up?
We've got our website, perimenopause.com.au. We're on Instagram as Perimenopause. I've got my own handle as Dr. Sunita Chalva. Yeah, check us out. Definitely, and connect, and feel free to message and reach out.
I will ask a question that I know I'm going to get in my inbox. Does Perimenopause do telehealth? I think that's going to be a big question.
We do. The only problem is we are completely overrun by patients, and so we don't have any appointments available in the foreseeable future. But I can certainly discuss with you the other places where women can go. There's good friends of ours who've started up a wonderful community called healthyhormones.au. If you join that, that's a fantastic community of women who very much would be interested in talking about neurodiversity, hormones, and the overlap, as well as clinicians as well, all of us who work in this space. So I think that's a great place to start if you have questions about your own personal journey.
Absolutely. Well, at the bottom of these show notes, I'm going to obviously put in Perimenopause. I'm going to put in the website, the Instagram. I'm also going to put in the recommended provider form. So if you have somebody that has given you great hormones and you think they're awesome and they do have space, you can fill out the form and I'll pop it onto the website for anyone to download. But thank you so much for your time, Sunita. I really appreciate it.
Oh, thanks, Jane. You've been very generous and I've really enjoyed talking to you. We've got so much more to talk about, so I look forward to it.
Quick announcement. Did you know that we have an ADHD Mums shop filled with resources designed just for you? These resources are packed with answers to the most frequently asked questions I get sent in via email. Everything from understanding ADHD and autism to practical tips for daily life. There's also a free assessment tool. If you're wondering about ADHD or autism for yourself or your little one, don't forget to check out the free assessment tool under free resources section on my website, adhdmums.com.au.